speech this afternoon. My topic will be why the government should mandate the HPV vaccine, or human papillomavirus vaccine, in adolescent females. And first of all, I'd like to tell you a little bit about my background. My name is Christine Freeberg, and I have been a registered nurse for the past 23 years. I have worked in various specialties, including ICU, oncology, medical surgical nursing, and OB/GYN. The past 18 years, I have been employed in an outpatient mental health clinic and have become certified in psychiatric and mental health nursing. I also am the supervisor of the infection control program there. And as part of that, I train staff on an annual basis at the clinic in bloodborne pathogen training. And the regulations for that are mandated by OSHA, or the Occupational Safety and Health Administration. The reason I'm mentioning that is because a lot of that training is in regards to hepatitis B, C, and D, as well as the HIV virus, or the virus that causes AIDS. And there are a lot of similarities between those viruses and the HPV virus that I'm going to tell you about today. I would like to start out by telling you a little story. Christine Bays was married to her husband for approximately 7 years, and they had been planning a family. In 2000, she was diagnosed with cervical cancer. She underwent a hysterectomy and had to have 3 months of chemotherapy and radiation. Had they caught the cancer earlier, she would have been able to keep her uterus. She was, quote, the girl who did everything right. She had annual pap smears. The pap smears that she had done yearly had missed the cancer that was growing inside of her for the past decade. She since then became the executive director of the Yellow Umbrella program, which is a cervical cancer prevention program, in 2002. She states, quote, I was devastated and incredibly pissed at my doctor's office. If they had found the tumor 3 years earlier, I could have kept my uterus and had a child. This is just one demonstration of what this disease, cervical cancer, and the HPV vaccine, our virus, can do to somebody's life. And this is a picture of the uterus, and it shows the cervical area in which the cancer cells form. So let's begin by discussing just what is HPV. It is called the human papillomavirus. And does anybody here know about it, or have you ever heard of it before?
Mm-hmm.
Yeah? What do you know about it?
I just think it's a virus.
Okay.
It's probably the most prevalent sexually transmitted disease. It does not necessarily have to be transmitted sexually, however. And the majority of people in this country have been exposed to it at some point in their life, even if they've only had one sexual partner.
You are correct. There are about 100 types of HPV. 30 to 40 of those are genital types. Sometimes people have it and they don't know it, and a lot of times the virus will clear up on its own. And it is extremely common. It's transmitted by a sexual contact from skin to skin. And the most common effect seen by this virus is actually warts. And it can be the warts that are found on your hands and feet. So you can also get those type of warts from sharing towels or other objects with people that have the virus. However, we are most concerned with the ones that the virus types that cause genital warts. There are 2 types that cause cervical cancer, and there are 2 specific types that they've identified so far that cause 90% of genital warts. And the types that cause cancer cause 70% of cervical cancers out there. So just what are the symptoms of HPV? Well, most of the time you have no symptoms at all. So that's where a lot of the treatment problem comes in. If you don't know you have it, how are you going to be treated? And the other way to tell is abnormal cells on a pap smear. And that is not always conclusive. For a pap test, we have to have somebody in a laboratory looking at a slide and determining if the cells are abnormal or not. And between 13 and 45% of those pap tests are false negatives. They are read as negative, and they are not negative. So that's a problem. And hopefully having the HPV test will help diagnose these cancers sooner. I also listed the symptoms of cervical cancer, and they can be bleeding or abnormal discharge from the vaginal area. They can be lower back pain, painful urination, or pain during sex. Some statistics, and I have this particular slide on the handouts for you because it is a lot of information, but it's something that you can take with you and refer to later. The statistics are quite unbelievable as to how many people are infected with this